Imagine a world where we can not only stop heart disease, but even reverse it. Thanks to groundbreaking research on high-intensity interval training, or HIIT, that dream is closer than ever. Heart disease remains the leading cause of death worldwide, with coronary heart disease playing a significant role. While we know exercise is beneficial for our hearts, this new study shows that HIIT can go a step further by actually shrinking the plaque in our arteries that causes heart attacks. We are no longer just talking about prevention, but rather about reversing damage once thought irreversible. Researchers at St. Olav's University Hospital in Norway investigated whether HIIT could reduce atherosclerosis plaques in the coronary arteries of patients with stable coronary artery disease. They conducted a randomized controlled trial comparing HIIT to standard care. The study, called CNET, included 60 patients who recently underwent procedures to remove blockages in their coronary arteries. Half were assigned to a supervised HIIT program twice a week for 6 months, while the other half followed standard precautionary measures. The HIIT sessions consisted of a 10-minute warm-up at moderate intensity, followed by 4 by 4-minute intervals at high intensity with 3 minutes of active recovery in between, ending with a 5-minute cool-down. These sessions were supervised by experienced physiotherapists, and participants were encouraged to continue interval training at home using wearable devices to monitor their progress. The control group was advised to follow current prevention guidelines without additional supervision or monitoring. The results were impressive. Patients in the high-intensity interval training group showed significant reductions in both the percentage of artery volume occupied by plaques and the total volume of plaques. In contrast, the control group showed no significant changes. Beyond plaque reduction, the HIIT group saw improvements in overall fitness, increased peak oxygen uptake, and decreases in body mass index and waist circumference compared to the control group. These groundbreaking results suggest that HIIT not only prevents further plaque formation, but can also reverse existing atherosclerosis. This is the first study to show such a significant impact of exercise on existing plaques, with results comparable to those from cholesterol-lowering drugs. The study's rigorous design and advanced imaging techniques highlight the potential benefits of incorporating HIIT into exercise programs for patients with stable coronary artery disease. It underscores the important role of exercise as a cornerstone of rehabilitation programs for cardiac patients. However, there were some challenges. The number of participants was relatively small at 60 patients. Despite this, researchers emphasize that this is still a significant number compared to similar studies, especially given the challenges of repeated medical procedures. Another challenge was that patients in the control group were advised to adhere to cardiac rehabilitation guidelines. This might have made them more active than originally planned or normally would be, potentially reducing the difference in activity levels between the two groups and influencing the results. If this is the case, HIIT would be even more effective compared to a reference group without such instructions. The researchers also noted that maintaining the level of exercise achieved in the study might be difficult without continuous monitoring. The small sample size, single-center implementation, and challenges in maintaining high-intensity exercise outside a supervised environment must be considered. It's essential to consult a doctor before starting any new exercise routine, especially for heart patients. Despite its limitations, this study paves the way for further research on the long-term effects of HIIT on cardiovascular health and its potential benefits for other populations. Remember, heart health isn't just about exercise itself, but about moving with intensity. HIIT could be the path to a healthier and potentially younger heart and vascular system. We wish you all a long, healthy, and happy life. See you next time.